Welcome back guys. Now in this video, let's discuss about the topic of contraception. Guys, contraception is a very big topic. So I'm dividing this topic of contraception into two parts. In the first part of video, I will be mainly discussing about the natural methods of contraception, barrier methods, oral contraceptive pills, progesterone-only contraceptives and intrauterine devices. In the second part of video, I will be mainly discussing about emergency contraception and permanent methods of contraception. Also, one more thing. See, in this video, I will be mainly discussing those important points which will be coming to your exams. Okay, so all high yield points will be discussed. Now, without any further delay, let's start the topic. Now, natural methods of contraception. Guys, natural methods include rhythm method, which means the couple are participating in intercourse only in those particular days which are considered as safe, which means a couple are participating in intercourse in the first 7 days of menstrual cycle and last 7 days of menstrual cycle. So these are considered as safe days. So even in those days, if they participate in intercourse, she won't get pregnant. Okay, something like that. So just by looking at the cervical mucus also, we will know when she is ovulating. Okay, just by looking at the cervical mucus consistency, we can know when she is ovulating. So female every day looks at her cervical mucus. So when her cervical mucus is just like egg white, it is stretchable, it is showing egg white consistency, which means she is about to ovulate. So in these days, for a couple of days, she will be avoiding intercourse so that she won't get pregnancy. So this is something natural. She is not using any barrier method. She is not using any oral contraceptive. So these are considered as natural methods of contraception, and the important MCQ is the cervical method. The cervical mucus method is also known as the Billings method. This is the MCQ. So Billings method is a natural method of contraception where a female is looking at the consistency of her cervical mucus. Now, basal body temperature method is also a natural method of contraception where a female is continuously monitoring her basal body temperature. The day basal body temperature is little bit raised, it is indication of ovulation. So she is going to avoid intercourse for a couple of days so that she won't get pregnant. Now, lactational amenorrhea. We all know that a breastfeeding female is going to have amenorrhea. Why? In a breastfeeding female, the good levels of prolactin will inhibit the hypothalamus and pituitary gland. So GnRH levels, FSH levels and LH levels, they will go down. Whenever there is no FSH and LH, there is no follicular development and there is no ovulation. If there is no ovulation, there cannot be pregnancy. So longer time of lactation or longer intervals of lactation, she can have longer duration of anovulation and longer duration of amenorrhea. So these are considered as natural methods of contraception. Now after this, let's talk about the topic of Pearl index. What exactly is this Pearl index? Guys, let me tell you, there are different types of contraceptives like male condoms, female condoms, oral contraceptive pills, progesterone-only pills or progesterone-only implants, progesterone injections. So many contraceptive methods are there. Do you think all of them are equally effective? Or do you think all of them are ideal contraceptives? No. Some of them are very good. Some of them are little bad. So what is that thing which tells you which contraceptive is good and which contraceptive is bad? It's the Pearl index. So Pearl index is used to measure the failure rate of a contraceptive, which means it tells you how bad a contraceptive is. Which also means it also tells you how good a contraceptive is. If it is more bad, it will be having more Pearl index value. If a contraceptive is having least Pearl index value, means it is a good contraceptive. Its failure rates are less. Okay, so according to definition, number of contraceptive failures happening per 100 women years of exposure. Okay, so this is the formula. See, no one is going to ask you the calculation, but formula is important. The formula is number of accidental pregnancies happened by number of women in study into number of months of use into 1200. Okay, we are calculating it for 100 women years. 100 women years means 1200 months. Okay, so Pearl index tells you how good or how bad a contraceptive is. So what is the next important point to keep in mind? They will ask you what is the Pearl index of a particular contraceptive. So you should by heart them. Guys, please concentrate here. In this slide, there are different contraceptives and their Pearl index values. Male condom contraception failure or male condom Pearl index is, it lies between 2 to 12. What is the 2 and what is 12? With perfect usage, with ideal usage, there are least chances that 2. With improper usage, the failure rates can be increased. That's 12. Okay, so ideal to improper. So male condom Pearl index value is 2 to 12. Female condom Pearl index value is 5 to 20. It will be somewhere between 5 to 20 according to how the couple have used it. Okay, so just by looking at it, can you tell out of male condom and female condoms who are better? It is the male condom. Why? Because its Pearl index value is less when compared to the female condoms. And the next important MCQ that they will be asking in the exams is, what is that contraceptive method which has least Pearl index value? The least Pearl index value is seen with the implants. Okay, so implants are having least Pearl index value, and it's very important that you have to by heart this Pearl index values for sure. Okay, now after this, let's talk about the barrier methods of contraception. The first barrier method I will be starting is the male condoms. Guys, male condoms are very good because they are the only ones, okay, the male condoms and even female condoms also, they are the only ones which will prevent the transmission of HIV. Okay, they will prevent the transmission of HIV. They also prevents the transmission of sexually transmitted diseases. So if they are decreasing the chances of sexually transmitted disease in a female, automatically pelvic inflammatory disease will be decreased. Why? Because we all know pelvic inflammatory disease is because of the infection. That's most commonly because of the chlamydia. So using condoms doesn't allow the chlamydia to transfer from one person to the other person, that is from male partner to female partner. So automatically pelvic inflammatory disease chances will be decreased. Also, as it is decreasing the transfer of sexually transmitted diseases, so HPV transfer from male to female also decreased. So HPV is not getting into the female body, so the chances of CA cervix will also be decreased. We all know CA cervix is because of the HPV. So using male condoms decreases the chance of transfer of HPV to female from male, so it decreases the chance of CA cervix. Also very important point is that using these male condoms or female condoms decreases the chances of ectopic pregnancy. How? Guys, remember, ectopic pregnancy is because of if there is any infection in the tubes. Remember, if there is any infection or any adhesions inside the tube, with these adhesions, okay, in the adhesions, there can be implantation of the embryo and there will be ectopic pregnancy. Remember, the adhesions inside the tube, they are because of the infections like genital tuberculosis or like because of the pelvic inflammatory disease. Now, important point is that if a couple they are using these condoms, the transfer of sexually transmitted disease is getting decreased. So whenever the sexually transmitted diseases are decreased in a female, the chances of adhesion formation in the fallopian tubes got decreased. So automatically ectopic pregnancy chances also goes down. So using this male or female condom decreases the chances of ectopic pregnancy too. Now these male condoms, they are just not only used as a contraceptive, but they can also be used as a condom catheters. Okay, what exactly are these condom catheters, guys? See, condom catheters means, for example, there is this male who is 80-year-old who is hospitalized and he is not able to go to his washroom. He is not able to go and have urination by himself. So what we can do, we can put these condom catheters, so he can urinate in these condom catheters and all this urine will be collected in the urobag. Okay, they can be used as condom catheters and they can be used as condom tamponade for ectopic postpartum hemorrhage. Even in the obstetrics, we have clearly studied that, see, if there is this atonic postpartum hemorrhage, there is a lot of bleeding. So how we can treat this bleeding? You can simply put a catheter inside the uterus and you can inflate this catheter, this condom with the saline. So what's happening? The condom is getting inflated inside the uterus with the saline. So this saline inflated condom is going to exert the mechanical pressure on the walls of the uterus. So because of this mechanical pressure, the bleeding is decreased. Okay, they can be used as condom tamponade. And if a female is having anti-sperm antibodies, okay, some females develop anti-sperm antibodies in their cervical mucus. So in that female who is having a tendency to develop anti-sperm antibodies, so in these females, male or female condoms can be used. Why? Because if a male is using this condom, the sperms are not going to enter into her cervix. So as days pass by, she is going to decrease the antibody production against the sperms. So in a female with anti-sperm antibodies, male condoms can be used so that gradually as time passes by, she will decrease the antibodies for the sperms. Okay, so these are some important points, and very important point is that these condoms should not be lubricated, especially latex condoms. Latex condoms should not be lubricated with oil-based lubricants. Oil-based lubricants should not be used. Only water-based lubricants like KY jelly should be used with the latex condoms. Okay, so these are some important points. Now, after male condoms, one important MCQ is, guys, there is this HIV patient. Okay, there is this HIV male. He want to have intercourse, but he don't want the female to get pregnant. First thing, he don't want the partner to get pregnant, and he also doesn't want the partner to get the HIV. So what is the best contraceptive method in a HIV patient? The best contraceptive method is intrauterine device in a female plus a barrier male condom to the male. So very important MCQ is, best contraceptive in a HIV patient is male should use the barrier and female should use the intrauterine copper device, intrauterine contraceptive device, so that she won't get pregnancy. So best contraceptive is intrauterine contraceptive device in a female and barrier method by the male. But if they ask you the question, if they change the question a little bit, if they ask you what is the best method to prevent the transfer of HIV, what is the best method to prevent transmission? For preventing transmission, they are not asking the contraception, they are asking method for preventing transmission in a HIV patient. Then the answer will be barrier method. Okay, so best method to prevent transmission is barrier method, and best contraceptive is IUCD in a female, and male should use the barrier. So these are some important MCQs which will be coming in the exams. After male condoms, let's talk about the female condoms. Guys, how to identify a female condom? Female condom will have 2 rings on both the sides. Okay, 2 flexible rings will be there, and important point is that, can this female condom be removed immediately after intercourse? Male condoms can be immediately removed after intercourse, there is no doubt, but can a female condom be released or removed immediately after intercourse? Yes, it can be immediately removed after intercourse. Okay, and how many types of female condoms available? The main category of the female condoms are known as FC1, FC2 and FC3. Okay, main classification: FC1, FC2, FC3. FC means female condoms. FC1 female condoms are made up of polyurethane. FC2, which was freely supplied by Government of India, is made up of nitrile. Okay, MCQ, this is the MCQ. And FC3 are made up of latex. FC1 with the polyurethane, FC2 with nitrile, and FC3 with the latex. Okay, very good. What are the advantages of female condoms? Can female condoms prevent the transfer of STDs? True. Can female condom prevent the transmission of HIV? True. But male condoms are better than female condoms. Now, FC2, that's made up of nitrile, see, it comes with a pre-lubrication, silicone-based lubrication is already present in the FC2 condoms which are made with the nitrile, and this one was freely supplied by the government of India. Okay, so these are some important points. Now, here this is an image-based question that the condom whatever is present here is a female condom. Now, let's talk about a few important points about the sponges, okay, vaginal sponges, which are also known as today. So direct MCQ is today is a vaginal sponge. Important point is how to identify this. See, this vaginal sponge and cervical caps, which we are going to discuss in a moment. Vaginal sponge and cervical caps, both are barrier methods. They just looks like the same. So how to differentiate between vaginal sponge and cervical cap? Guys, vaginal sponges will come with a band. So if you can see this loop or if you can see this band, it is today or vaginal sponge. Guys, with this contraceptive, with this barrier method of contraceptive, you will get 1 gram nonoxynol-9. What is this 1 gram nonoxynol-9? This 1 gram nonoxynol-9 is a spermicide. So if they ask you a question, what is that barrier method of contraception which comes with spermicide? It is vaginal sponge. So vaginal sponge, which is also known as today, it contains 1 gram nonoxynol-9, and it also provides prevention. It's also protect against the sexually transmitted diseases, but not HIV. It is protecting certain sexually transmitted diseases, true, but not HIV. So who prevents against HIV transmission? It's the condoms. Male condom is best. Now, see, female condom, it can be removed immediately after intercourse, but these vaginal sponges or vaginal diaphragms or cervical caps, which we will be discussing in a moment, see, these barrier methods cannot be removed immediately. MCQ. So, vaginal sponge should not be removed immediately, which means a female have to wait a certain period of time for the removal of this vaginal sponge. How much time she should have to wait? See, the removal should be done after 6 hours. Okay, after 6 hours after the intercourse, then only these vaginal sponges should be removed. Okay, and they are one time use only. They shouldn't be used multiple times. It should be one time use, and there is no risk of toxic shock syndrome. Why I am saying this? With the use of cervical cap or cervical diaphragm, there is a risk of toxic shock syndrome. But in this condition, our vaginal sponge is coming with 1 gram nonoxynol-9. It just acts like an antibiotic and doesn't allow the staphylococcus to grow. Okay, so staphylococcus is the one which is causing the toxic shock syndrome by producing enterotoxin F. So this spermicidal agent 1 gram nonoxynol-9 is not allowing the Staph aureus to grow, so that there is no risk of toxic shock syndrome. But with vaginal diaphragm and with cervical caps, there is a risk of toxic shock syndrome. Okay, there is no doubt. All important points completed, and these vaginal sponges should not be removed immediately. At least 6 hours should be waited after intercourse. Okay, now after this, let's talk about vaginal diaphragms and cervical caps. I have said you, please concentrate. They just looks like the vaginal sponges, but there is no band. Okay, and the image whatever you are seeing over here, okay, here this is the vaginal diaphragm. Guys, they are also the barrier methods. They shouldn't be removed immediately after intercourse. At least 6 hours the female have to wait after the intercourse. And important point is that there is a risk of toxic shock syndrome because there is no spermicidal agent. There is no 1 gram nonoxynol-9 with the vaginal diaphragm or cervical cap. Okay, now they also give protection against the STDs, but not for the HIV. Okay, so these are some important points about vaginal diaphragms and cervical caps. Now after this, let's talk a few important points about the spermicides. Guys, never ever spermicides should be used alone. They should never be used alone. Why? Because there are higher chances of failure. What exactly is a spermicide? Spermicide is a chemical that kills the sperms upon contact, but they should never be used alone. They should be used along with the condoms or they should be used along with the cervical caps or diaphragms, but they should not be used alone. Okay, that's a very important point. And can you give me some examples of spermicides? Yes, they are nonoxynol 9, octoxynol, and menfigol. Okay, these are famous spermicidal agents. And out of all, the most commonly used is nonoxynol 9, where we have studied nonoxynol 9 1 gram is present in the today or vaginal sponge. Okay, that's a very important point. And one more important MCQ is, what is the mechanism of action by which this nonoxynol 9 is killing the sperms? The mechanism of action is by disrupting the cell membrane of the sperms. Okay, by disruption of cell membrane of the sperms, this nonoxynol 9 is killing the sperms. And I have already said you, they should never be used alone. Okay, they should be always used in combination with the barrier methods. Okay, completed. Now let's talk about oral contraceptives. Guys, what exactly are these oral contraceptives? See, these oral contraceptives are also known as combined OCPs, combined oral contraceptive pills. They are contraceptive pills. What is that combined name? Combined means it's a combination of, these pills are combinations of estrogen plus progesterone. So in oral contraceptive, what exactly is there? Estrogen is there and progesterone is there. And how they are actually bringing out this contraception? See, estrogen, it downregulates the FSH in the female body. The progesterone is going to downregulate the LH. So in a female body, FSH levels are going down, LH levels are going down. If there is no FSH and LH, there is no chance that her ovarian follicles are growing and ovarian follicles are rupturing. No, it won't happen. Why? Because FSH gone down, LH gone down. So there is no ovulation. If there is no ovulation, automatically there is no chance of fertilization and pregnancy. Okay, so this is how oral contraceptive pills are, like, showing their action. But in the exam, if they ask you what is the main mechanism of action of oral contraceptive pills, guys, this is very important. I used to remember something like this. If I am talking about oral contraceptive pills, OCPs, the main mechanism of action lies with the letter O. That is, it inhibits these oral contraceptive pills, they inhibit the ovulation. O for ovulation inhibition. That's the main mechanism. So what is the C, sir? See, C for, these oral contraceptive pills not only inhibit the ovulation, but they will make the cervical mucus thick enough so that the sperms cannot enter into the uterine cavity. If the sperm is not entering into the uterine cavity, there is no chance that it will meet the ovum and fertilization happens. No chance. So the second mechanism of action is they makes the cervical mucus hostile for the sperms, doesn't allow the sperms to penetrate this cervical mucus. And third important point is P. P for prevents the implantation. See, these oral contraceptive pills, they will bring endometrial atrophy. They will cause the endometrial atrophy and prevents the implantation. So what are the three important mechanisms of action of oral contraceptive pills, guys? Inhibits the ovulation, main mechanism of action, makes the cervical mucus hostile for the sperms, and third one is prevents the implantation. Now, there are certain direct MCQs. See, can these oral contraceptive pills, please concentrate, can these oral contraceptive pills used as a contraception in a newly married couple? Yes. See, in a newly married couple, if they came to you, they just said, we are newly married, we just want to go with a contraception, we just don't want to have a baby right now, we just want to go with a contraceptive method. So which contraceptive is ideal in a newly married couple? See, in a newly married couple, most of the students think it's the condoms or the barrier methods are ideal contraceptive. No. In a newly married couple, condoms, they will interfere with the pleasure of the sexual activity. Okay, they are newly married, so don't just give them the barrier methods, give them oral contraceptive pills. So oral contraceptive pills are ideal contraceptive of choice in a newly married couple. That's a very important MCQ. Now after this, let's see some non-hormonal benefits of a oral contraceptive pill. OCPs, they prevent the pregnancy, everyone know. But other than just preventing the pregnancy, they are also having certain important benefits. What are they? See, they are the drug of choice for, let me tell you one thing. For every problem in female, the oral contraceptive pills are the ones which are going to come into the play. Oral contraceptive pills are wonder drugs for female. Whatever the problem, they will take care. So their drug of choice for hirsutism, their drug of choice for irregular menses. Okay, irregular menses, that is oligomenorrhea. Okay, for irregular cycles, their drug of choice for too much amount of menses, that is menorrhagia. If there is so much amount of menses, oral contraceptive pills. If there is irregular menses, oral contraceptive pills. If there is too much pain during menses, that is dysmenorrhea, again treatment of choice is oral contraceptive pills. Okay, if there are fibroids, guys, in the management of fibroids we have discussed. See, if the fibroids are intramural fibroids or subserous fibroids, what we are going to do? We are going to do the first line management with first tier drugs. That's the medical management. In the fibroids topic we have discussed. There we are going to use oral contraceptive pills, progesterone-only pills, 𝗏𝐴𝐺𝐼𝐻 acid, which will decrease the bleeding. So in a female who is having fibroids, their oral contraceptive pills can be used. If a female is having endometriosis, guys, let me ask you one question. If a female is having endometriosis, her main problem is what? Excessive pain during menstruation. Endometriosis, too much pain. So how to treat that? Stop the menses. How can we stop the menses? If you give this oral contraceptive pills continuously without stopping, if you give this oral contraceptive pills, hormonal pills continuously, her menses will be stopped. So endometriosis can be treated with oral contraceptives, and even ovarian cysts can be treated with oral contraceptives. These are these are non-contraceptive benefits of oral contraceptive pills. Guys, now let's discuss about cancers which are associated with oral contraceptive pills. See, by taking oral contraceptive pills, the female, she is at a risk of developing certain cancers. What are those cancers, guys? It's mainly the cervical cancer, that too adenocarcinoma of cervix. See, using oral contraceptive pills, now she is at a risk of developing cervical adenocarcinoma, and also there are least chances of developing breast cancers. Guys, oral contraceptive pills are good, but using oral contraceptive pills, she is at a risk of developing certain cancers. But important point is that using oral contraceptive pills prevents certain cancers. See, imagine that there is this female who is using oral contraceptive pills. Now she is at a risk of developing cervical cancer, but at the same time she is protected against certain cancers. What are those cancers? Endometrial cancer. Yes, taking oral contraceptive pills prevents against endometrial cancer, ovarian cancer, colorectal cancer, and benign breast disorders. Now you might think, sir, endometrial cancer is seen because of hyperestrogenic states. Endometrial cancer is because of the hyperestrogenic states. What exactly are oral contraceptive pills? Oral contraceptive pills are estrogens plus progesterone. So how can we give, or you can ask me, how can this oral contraceptive pills prevent against the endometrial cancer? Guys, important point is that, please remember, the amount of estrogen and progesterone, whatever is present in the oral contraceptive pills, are very less. It is the least doses of estrogen and it is the least dose of progesterone. So in those least doses, okay, in those least doses, they will prevent the endometrial cancer. Okay, let me tell you in a very simple way. Hyperestrogenic states predisposes to endometrial cancer. Now, if a female is taking oral contraceptive pills, her hypothalamo-pituitary ovarian axis is inhibited. So she is not producing any estrogen. We are giving estrogens and progesterones to her. How much amount of estrogens and progesterones we are giving? Least amount of estrogens. So if hyperestrogenic states are risk factor for endometrial cancer, now what we are giving is the least amount of estrogens. So these least amount of estrogens will prevent against endometrial cancer as well as ovarian cancer. Why? Because hyperestrogenic states are also risk factor for ovarian cancer. Okay, so these are some important points which need to be kept in mind. Cancers associated with OCPs, cancers prevented by the use of OCPs. Okay, very important. Now after this, what are the conditions in which oral contraceptive pills should never be given in a female? Which means absolute contraindications for the oral contraceptive pills. Every time there will be a question in the exam from this topic. Okay, so absolute contraindications of oral contraceptive pills. Guys, there are almost 11 conditions which are very, very important. See, there is undiagnosed vaginal bleeding, which means she might be having cervical cancer or she might be having endometrial cancer right now. See, both the conditions are somewhat estrogen dependent. So, important point is that if they already had, see, it's not like, the topic which we have discussed before. What we have discussed, taking oral contraceptive pills prevent against the endometrial cancer. But if she already had endometrial cancer, you should never give oral contraceptive pills. See, there is this undiagnosed vaginal bleeding. This undiagnosed vaginal bleeding may be because of endometrial cancer. So, you should never give oral contraceptive pills. Or if the female is having a history of a thrombosis or stroke or coronary artery disease, she should not be kept on oral contraceptive pills. Why? Why? Because we all know oral contraceptive pills are nothing but estrogen, progesterone. See, estrogenic component, estrogens will increase the clotting factors and causes hypercoagulable state. So, hypercoagulable state means there is a risk of a thromboembolism. So, taking oral contraceptive pills, there is a risk of thromboembolism. If a female, if she already had any episode of thromboembolism, or if she had stroke, okay, stroke is because of embolus going into the cerebral vasculature. If she had thromboembolism or stroke or coronary artery disease, don't give her oral contraceptive pills. Okay, MCQ. And pregnancy is an absolute contraindication. It's very clear, right? These are contraceptives, doesn't allow the pregnancy. So, in a pregnancy, if a woman is already having pregnancy, don't give her oral contraceptive pills that may cause abortion. Now, in severe hypercholesterolemia or severe triglyceridemia, oral contraceptives are contraindicated. Why? Why? Because estrogens will increase the triglycerides level. As they are increasing the triglyceride level, they should not be given if a female is having hypercholesterolemia or triglyceridemia. If you give means her problem will worsen. If there is liver failure, don't give her oral contraceptive pills. Why? Because estrogens and progesterones, they should be metabolized inside the liver. If there is a liver failure, don't give OCPs. Why? Because the estrogen and progesterone, they are not getting metabolized so that they can show the side effect. Okay, so in liver failure patient, absolute contraindication. If there is breast cancer, don't give. These estrogens can act on the cancer and will further aggravate the cancer. And also remember guys, if a female is a smoker after 35 years, or if there is vascular disease, uncontrolled hypertension, migraine with aura, and very, very important, after delivery for 21 days, she should never take oral contraceptive pill. Very, very important MCQ. Why? This is very important MCQ. See, delivery after 21 days. Not like exactly what I am saying. See, after delivery 21 days. That's what I mean by after delivery 21 days, she should not take oral contraceptive pills. Why? Why? Because we all know that pregnancy is a hypercoagulable state. During pregnancy, all clotting factors are elevated. It's a hypercoagulable state. As it's a hypercoagulable state, just after delivery, do you think all clotting factors are going down? No, all clotting factors are not going down. So, clotting factors are elevated even after the delivery. So, if you give oral contraceptive pills as a contraception to this female within this 21 days, what happens? Within this 21 days, clotting factors are elevated. You are again giving estrogens. They will further increase the clotting factors so that there is a risk of a thromboembolism. So, very important MCQ. After delivery for 21 days, the female should never be kept on oral contraceptive pills. Okay, it's an absolute contraindication. So, all these are the contraindications which every time, every time in the exam, they will be asking a question something like, all of the following are the absolute contraindications except. Okay, I gave you all the absolute contraindications. Now, after delivery, 21 days completed. Now, this female is giving breastfeeding. Now, can oral contraceptive pills be given in this female? 21 days are completed. But this female is breastfeeding. In a breastfeeding female, can contraceptives be allowed? Especially this oral contraceptives will be allowed. OCP pills are allowed or not? They are not allowed. they are contraindication. Why? Why? Because she is breastfeeding. Oral contraceptive pills interfere with breastfeeding. They decrease the amount of milk production. So important MCQ is oral contraceptive pills are not used in a breastfeeding females or lactating females because they decrease the breast milk production. And oral contraceptive pills, they are also not teratogenic drugs. Okay, they are not teratogenic drugs. What exactly I mean by, remember guys, now she is taking these oral contraceptive pills. Unfortunately, she had this pregnancy. For example, she had started oral contraceptive pills on 20th day of her menstrual cycle. Okay, there is this female who had this quick start of oral contraceptive pills on 20th day of her menstrual cycle, which means she had completed the 14th day. On 14th day, she might be having ovulation. Yes, on 20th day, definitely she will be having ovulation. On 20th day, she had this ovulation, and on the day or the next couple of days, she had participated in the intercourse so that she has had fertilization. Okay, fertilization is there. Now she is a pregnant, but she doesn't know that she is a pregnant. On 20th day, she have started taking the OCPs. Now, does taking this oral contraceptive pills can cause any teratogenicity in this growing baby? No. Oral contraceptive pills, they are not teratogenic drugs. Okay, very important point, and they should never be given in a breastfeeding females, and they should never be given after delivery for 21 days as there is a risk of thromboembolism. And what is the most common side effect of the oral contraceptive pills? It's the breakthrough bleeding. Okay, the spotting will be there with the use of this oral contraceptive pills. Why? Why? Because we are giving oral contraceptive pills, which means estrogen and progesterone we are giving. Her body is not making the estrogen and progesterone. We are giving estrogen and progesterone. Sometimes whatever the estrogen and progesterone we are giving, they are not sufficient for the needs of the endometrium. See, in her uterus, endometrium is there, right? Whatever the estrogen and progesterone we are giving, that might not be sufficient for the endometrium, so that this endometrium might detach and bleed. So, breakthrough bleeding is most common side effect, and in the later slides we will see how to treat this breakthrough bleeding. Okay, now let's discuss something about the missed pills. Very important topic. What exactly are these missed pills? Now, a female should have to take oral contraceptive pills regularly. Okay, let me tell you some basics. Guys, oral contraceptive pill pack, it comes with 28 pills. Okay, 28 pills are there. Out of 28 pills, 21 pills are hormonal pills. They contain estrogen and progesterone. The last 7 pills are iron pills. They are iron pills. Okay, so 21 pills are the real oral contraceptive pills. So 21 means how many weeks? Just tell me. So from the day 1 of her menstrual cycle, usually we used to say something like this: a female should have to start taking oral contraceptive pills from day 1. Day 1 is first day of her bleeding. So this is normal 28 days. On 14th day, she will be ovulating normally. So first 7 days, she will be taking oral contraceptive pills. Second 7 days, that is the second week, she will be taking oral contraceptive pills. 14 pills are completed. In the third week, again she will be taking oral contraceptive pills, which means 21 pills are taken in 3 weeks. Last week, okay, that is the 4th week. Is she taking any oral contraceptive pill or is she taking any hormonal pill? No, she is not taking any hormonal pill. She is taking iron pills. So, last 7 days of the menstrual cycle, she is not taking any hormones, which means she is not taking any progesterones. If she is not taking any progesterones in the last 7 days, it is just looking like progesterone withdrawal happened. For the first 21 days, there is this progesterone. Last 7 days, there is no progesterone. So, it is progesterone withdrawal. On 28th day, she will start to bleed. At the end of the cycle, she will start to bleed because of progesterone withdrawal. So, oral contraceptive pills are taken for how many weeks? 3 weeks. That's the one important point I want to put into your mind. 3 weeks. So, anywhere in these 3 weeks, she might miss one pill or 2 pills? So what should be done? If she fails to take a pill, if she misses a pill, what should be done? So that's what we will discuss. Now, if she misses 1 pill, for example, let's take with the 1 pill. Okay, she misses 1 pill. In which week she misses doesn't matter. If it's only 1 pill, in which week it misses? First week, second week, third week, it doesn't matter. Okay, any week doesn't matter. The next pill should be taken as soon as possible. Okay, the next pill should be taken as soon as possible. What is backup? What exactly is this? Guys, she missed a pill, so that she is at a risk of getting the pregnancy. Now, as she missed the pill, does she need any protection? Now, she is taking oral contraception. She missed a pill. So, the next coming days, does she need any other contraception use? No. See, if she is only missing 1 pill, there is no need of any backup method. There is no need for her to use condoms for the next upcoming days. Now, what if she misses only 2 pills? If she misses 2 pills, in which week she misses is important. If she is missing the pills in first week or second week, then what should be done? The next pill when she should take. The next pill should be taken as 2 pills for the next 2 days. Okay. See, last 2 days is she missed the pills. Okay. Yesterday and day before yesterday, she forgot to take the pills. So what she should do? Today and tomorrow, instead of taking 1 pill, she should take 2 pills. So 2 pills should be taken for the next 2 days after missing. Okay. Does she need any backup? See, now the chances of getting pregnancy is more. So for the next days, she might have ovulated. The main mechanism of oral contraceptive pills is inhibiting ovulation. She missed the pills, she might be ovulated. So we should never allow the sperm to come and meet with the ovum. So backup is needed with the barrier methods. So the male or female, they should use the barrier method of contraception for the next upcoming 7 days. Okay. Now, she again missed 2 pills, but in the 3rd week. Okay, in the 3rd week, what should be done? Discard the current pack, start the new pack. Okay, new pack of pills should be started and backup should be used for the next upcoming 7 days. Now, what if 3 pills she missed? Continuously 3 pills are missed. What should be done? Guys, it doesn't matter whenever she have missed the 3 pills. Okay, whether it be any week, first week, second week or 3rd week, what should be done? Again start the new pack. If 3 pills missed any week, start the new pack. Discard the current pack, start the new pack, and there is need of backup for the next 7 days. Next 7 days she have to take the barrier method of contraception. Okay, that's the very important points about the pills. Okay, missed pills. Now, I have already said you that with the usage of oral contraceptive pills, the main problem is breakthrough bleeding. Okay, now she is having a little amount of bleeding. Now, how to treat that? See, we will be asking her, when you are having bleeding, do you have bleeding in the first week or do you have bleeding in the second half of the menstrual cycle? Not first week or not second week. I am just trying to say that if she is having this breakthrough bleeding, I will be asking her, when you are having this bleeding, if she had this bleeding in the first half of menstrual cycle, which means whatever the estrogens you are giving, it's not sufficient for the endometrium, so that there is bleeding. So what you have to do, you have to increase the estrogens. For example, if she is saying that I am having bleeding in the second half of the menstrual cycle, it means that whatever the progesterones you are giving, those progesterones are not enough for the endometrium. So bleeding is happening. So what you have to do? Increase the dose of progesterones in the oral contraceptive pills. So if there is a spotting in the first half, that is a proliferatory phase, increase the dose of estrogens. If there is spotting in the second half of the menstrual cycle, you have to increase the dose of progesterones. So this is how we are going to manage the breakthrough bleeding of oral contraceptive pills. Okay, so we have completed the missed pills topic and also we have completed the spotting with the oral contraceptive pills. Now after this, let's talk about the composition of the oral contraceptive. See, so far what we have discussed, oral contraceptive pills, they are a combination of estrogen and progesterones. So what is that estrogen present in the oral contraceptive pill and what is that progesterone which is present in the oral contraceptive pill? Guys, please concentrate. The available, the most widely available oral contraceptive pills in India are Mala D and Mala N. So both of them are having the same composition. The estrogen present in the oral contraceptive pill, the most common estrogen is ethinyl estradiol 30 mcg. The most common estrogen present in the oral contraceptive pill is ethinyl estradiol. And what is that progesterone which is present in the oral contraceptive pill? It is levonorgestrel 0.15 milligram. Both Mala N and Mala D, both of them are having the same composition. But if they ask you, Yasmin, which is also a oral contraceptive pill, it also have ethinyl estradiol, but the progesterone is a bit different. It is the drosperinone. Okay, so drosperinone is a progesterone. Okay, 3 milligram drosperinone is present. See, this drosperinone, please concentrate here. This drosperinone is a 4th generation progesterone. So in Yasmin, which progesterone is present? Drosperinone, a 4th generation progesterone. But what is the usual progesterone which is present in Mala N and Mala D? It is levonorgestrel. So levonorgestrel is a 2nd generation progesterone. Okay, those are some important points you need to keep in mind. So in a oral contraceptive pack, how many tablets are coming? 28 tablets are coming. Out of 28, 21 pills are hormonal pills and the rest of the pills are iron pills. So this iron is in which form? Ferrous sulfate or ferrous fumarate or something else. Guys, very important. The iron pills, the iron whichever I am giving to prevent the anemia in this female. Okay, usually females have anemia. So to treat the anemia, why? Because she is bleeding, right? So to treat the anemia, I am going to give the last 7 pills as iron pills, and iron in which form? Ferrous fumarate form. Okay, so this is the MCQ. So we have completed a very important topics about the oral contraceptive pills. Now let's talk about progesterone only contraceptives, which means the contraceptives whatever we are giving, it only contains progesterone but not the estrogens. For example, guys, in oral contraceptive pills, estrogen is there as well as progesterone is there. But the contraceptives whatever we are going to discuss right now, they are only having progesterone in them. So how many types of progesterone only contraceptives are available? There are 3 types. See, progesterone only pills, they are tablets. Progesterone injections can be there and progesterone implants are there. Okay, there are 3 types of progesterone only contraceptives. 3 types. Now let's discuss main important points. Now, usually OCPs we are giving, right? Then what is the need of progesterone only contraceptives? Because see, there are certain contraindications for OCPs. There are certain group of females where we are not supposed to use the oral contraceptive pills. So in those females where the estrogen containing OCPs are contraindicated, in those females we can safely give progesterone only contraceptives. Okay, so now let's take this point. These progesterone only contraceptives, they are used in women who cannot use the estrogen containing oral contraceptive pills. Okay, so they can be used in female who is having history of thrombosis. What does I mean by? If a female is having history of thrombosis, history of coronary artery disease or history of thromboembolism, we should not use OCPs. But instead of OCPs, as a contraceptive, you can use progesterone only contraceptives. Okay, but there is one exception: implants should not be given, which means progesterone only pills can be given, progesterone injection can be given, but not the implant. That's an exception. And also in the same way, a female with hypertriglyceridemia. Guys, a female with hypertriglyceridemia or female with hypercholesterolemia, we are not supposed to give the estrogens. So in those females who are having hypercholesterolemia or hypertriglyceridemia, we can safely give the progesterone only contraceptives. But exception is DMPA. DMPA should not be given. What exactly is DMPA? DMPA is progesterone injection. So progesterone injection should not be given, but progesterone only pill can be given or progesterone implants can be given. Okay, even if there is hypertriglyceridemia. And women, this is the very important MCQ. This is the one thing which I want to put into your mind. Guys, if a woman is lactating or breastfeeding, oral contraceptive pills are contraindicated. Why? Because they decreases the breastfeeding, they decrease the milk production. But progesterone only contraceptives, especially progesterone only pills, can be safely given. Okay, they are not going to interfere with the breastfeeding. Okay, these are some important MCQs. Now, guys, what is the mechanism of action? Oral contraceptive pills, the main mechanism of action is inhibiting the ovulation. There is no doubt. But how the progesterone only contraceptives are going to work? Guys, it depends on the dose. For example, if I am talking about POPs, progesterone only pills. See, progesterone only pills, they are having low doses of progesterone in them. As they are having low doses of progesterones, these POPs are going to act by thickening the cervical mucus. So, in low doses, these progesterones are going to thicken the cervical mucus so that sperms cannot penetrate the cervical mucus, so that there is no fertilization. Okay. Now, in high doses, where we will see high doses of progesterones, high doses of progesterones are seen in progesterone injections and progesterone implants. See, here there are high doses of progesterones. See, in high doses, these progesterone only contraceptives, they are going to cause anovulation. The main mechanism of action is anovulation, just like OCPs. Now, important point is POPs. The main mechanism of action is thickens the cervical mucus. Progesterone injections or progesterone implants, they are going to act by causing an ovulation. Okay, these are some important MCQs. Now, after this, guys, failure of a progesterone only contraceptive will result in ectopic pregnancy. Very, very important point. Why? Guys, she is every day taking POP, okay, progesterone only pill, or she is taking progesterone injections or progesterone implant. By chance, if there is a pregnancy, this pregnancy would most likely to end up as ectopic pregnancy. Why? Why? Because she is taking progesterones. Progesterones are smooth muscle relaxants. So, her fallopian tube lost the action of peristalsis. We know that peristaltic action of fallopian tube is the main action for the movement of fertilized embryo to enter into the uterine cavity. So, for the movement of fertilized embryo from the fallopian tube to uterine cavity is mainly because of the peristalsis. Now, she is taking progesterone only contraceptives. So, she is taking progesterones. So, as she is taking the smooth muscle relaxant, fallopian tubes are not moving. So, by chance, if she is having a pregnancy, if her ovum is fertilized, this fertilized embryo is not going to enter into the uterine cavity. It is going to get implanted in the fallopian tube itself. So, failure of progesterone only contraceptive can lead to ectopic pregnancy. Very important MCQ. And these progesterone only contraceptives, they cannot be used as emergency contraceptives. Okay, so you know what exactly are the emergency contraceptives, right? So emergency contraceptive means a female and male, they are not using they are using a barrier method of contraception. Suddenly there is a tear in the condom, so there is spillage of this semen into the vagina, so that now she is at risk of getting the pregnancy. So immediately what she should do, she should go for the emergency contraception. But can these progesterone only contraceptives used as emergency contraceptives like progesterone only pills, progesterone injections, progesterone implants, they can be used as emergency contraceptives? No, they are not supposed to be used as emergency contraceptives. Now, one more important point I want to put into your mind is, guys, progesterone only pills, how they are working. Progesterone only pills, mainly they work by making the cervical mucus thick. Okay, see, progesterone injections and progesterone implants, how they will work? They will mainly work by anovulation. But remember, progesterone injections and progesterone implants, they will also cause thickening of the cervical mucus. So progesterone only pills or POPs, progesterone injections, progesterone implants, all of them, They causes the thickening of the cervical mucus. If they thickens the cervical mucus, do you think that microorganisms, bad bacteria can enter from vagina to uterus? No. So as it thickens the cervical mucus, there is decreased chances of transfer of bad bacteria into the uterine cavity, so it prevents the pelvic inflammatory disease. Yes, true. Progesterone only contraceptives, they will prevent the pelvic inflammatory disease MCQ. Okay. Now after that, let's talk about the contraindications of the progesterone only contraceptive. Guys, what are the absolute contraindications for oral contraceptive pills? We have discussed. In the same way, there are certain absolute contraindications for taking the progesterone only contraceptives. Something like if there is undiagnosed, same like oral contraceptive pills, but the number of contraindications got decreased. There are 11 contraindications. Here there are only 5 contraindications. What are they? Undiagnosed vaginal bleeding, if there is breast cancer or pregnancy, liver disease and history of thrombosis. Guys, this is important. Usually, please concentrate here. If a female have thrombosis, their OCP should not be used. But progesterone only contraceptives can be used. But which type of progesterone only contraceptive should not be used? Implants. Other than implants, progesterone only pills, progesterone injections can be used, but implants should not be used in a female who is having history of thrombosis. So these are the important contraindications for progesterone only contraceptives. Okay. Now we have completed important points. Now let's discuss in detail important points about progesterone only pills, progesterone injections and progesterone implants. Okay, importance. Now let's start with the progesterone only pills. Guys, let's see. They contain progesterone only pills. They contain only low doses of progesterone. Yes, we already know that. And there is no estrogen. Now, these progesterone only pills, POPs, they are also known as mini pills. Okay. What is the mechanism of action, guys? I have already said you the main mechanism of action in low doses. It makes the cervical mucus thickening. And the only progesterone only pill or the only mini pill which is available in India is 𝗓𝐸𝐷 MCQ. So 𝗓𝐸𝐷 is the only mini pill which is available in India. And what is the type of progesterone which is present in this 𝗓𝐸𝐷? It is desogestrel 75 microgram. So desogestrel 75 microgram is the one which is present in the 𝗓𝐸𝐷, which is the only available mini pill in India. And what's the most common side effect? Same, it's just irregular menstrual bleeding. Just like OCPs, they also can have irregular menstrual bleeding. And I have already said you all progesterone only contraceptives. It's not like only POPs or only injections or only progesterone implants. No, all of them collectively they can prevent against the pelvic inflammatory disease. Yes, POPs can prevent the pelvic inflammatory disease, progesterone implants can prevent the pelvic inflammatory disease, and progesterone injections can prevent the pelvic inflammatory disease. Now after saying that, guys, here you can see 𝗓𝐸𝐷. Okay, if they ask you, just try to answer logically. If they ask you 𝗓𝐸𝐷, what is the mechanism of action? Now you will be thinking, sir, 𝗓𝐸𝐷 is the only mini pill which is available in India. If it is mini pill, it's a progesterone only pill. So progesterone only pills, the main mechanism of action is thickening the cervical mucus. So you will be answering me, okay, the main mechanism of action of 𝗓𝐸𝐷 is thickening of cervical mucus. No. Guys, 𝗓𝐸𝐷, it's a mini pill. True. It's a progesterone only pill. But its main mechanism of action is not thickening the cervical mucus. Its main mechanism of action is inhibiting ovulation. So 𝗓𝐸𝐷's mechanism of action is inhibiting ovulation. Okay, so important points about progestin only pills are completed. Now let's talk about progesterone injections. So what is that progesterone injection which is widely available in India? It is known as ANTRA. Okay, ANTRA. Okay, it was freely supplied by the government of India. Guys, important points, please concentrate. ANTRA, okay, which is DMPA. Now, what is the route? It's the IM route. A female should have to take this injection via intramuscular route. And very important point is how much will be given. Dose is 150 milligram injection given intramuscularly. Now, a female should have to take this injection once in 3 months. Okay, every 3 months, once in every 3 months, she have to take this injection. And what is the main mechanism of action, guys? These are high dose progesterones. In high doses, they will inhibit the ovulation. So, what is the mechanism of action of Antra or DMPA? It is inhibiting ovulation. Very important MCQ. Now, see, there are certain important benefits with this Antra. What are they? Now, if you can see here, this Antra or this DMPA, it's not only acting as a contraceptive, but this Antra decreases the sickling of the RBC. So, how this is going to be helpful? There is this female who is suffering with sickle cell anemia and she also wants a contraception. So, sickle cell anemia with contraceptive need. So, in these females, the contraceptive of choice is Antra or DMPA. So, it decreases the sickling of RBC. So, in a sickle cell patient, the contraceptive of choice is Antra. And also, this Antra DMPA decreases the seizure frequency, decreases the seizures. So, those females, those epileptic females who also want a contraception, so in them, it's the contraceptive of choice. So, contraceptive of choice in a seizure patient or epileptic female is Antra or DMPA injection once in 3 months, 150 milligram should be given. Okay, MCQ. Can it be used in lactating females? Yes, OPC should not be given, but Antra can be used in a lactating female also. Okay, so progesterone only contraceptives can be safely given in a lactating female, but oral contraceptive pills should not be given in a lactating female. Now, are they going to prevent the pelvic inflammatory disease? Yes, all the progesterone only contraceptives, they will make the cervical mucus thick and they can be used as, they can be used to prevent the pelvic inflammatory disease also. Not they can be used to prevent, they prevents the pelvic inflammatory disease. Okay, that's a very important point. Now, there are certain disadvantages with this DMPA. What are those disadvantages, guys? See, it will cause osteoporosis. Okay, this DMPA is associated with osteoporosis, weight gain and diabetes mellitus. And also very important point, using oral contraceptive pills, I forgot to mention earlier, if a female is using oral contraceptive pills, now she want to have a pregnancy, what she have to do? She have to stop the oral contraceptive pills. Now she stopped the oral contraceptive pills. Now in her, for the reversal of her fertility, it takes almost 3 months. So within 3 months, she is going to become fertile again after stopping the OCPs. So after OCP stoppage, it takes almost 3 months for the reversal of her fertility. Now, if she is using this high dose progesterone injections, DMPA, it takes almost for the reversal of fertility, it's taking almost 1 to 1.5 years. So if she want to get pregnant again, it takes almost 1.5 years to become fertile. Okay, so this is the disadvantage. So I have discussed all the important points about progesterone only pills and progesterone injections. After progesterone injections, we are left with progesterone implants. Okay, already we have discussed implants are the ones which have least failure rate, least Pearl index is seen with implants. Now, let's talk about the implants. Guys, regarding implants, there are very few important MCQs. What are they? I have already said you implants have least failure rate. Okay, least failure rate is completed. Now, what is the only progesterone only pill available in India? What is the only pop or only mini pill available in India? It is Cerazid. What is the progesterone injection widely used in India? It is DMPA, Antra. In the same way, what is the progesterone implant that is used? It is Implanon. Okay, MCQ, Implanon with what is the progesterone which is present inside it? It is etonorgestrel. So, etonorgestrel is present in Implanon. It's an implant. But this implant, can it be taken on X-ray? Is it going to be visible on X-ray? Important MCQ. Implanon is radiolucent. So, it's not captured with an X-ray. It's not going to show up in the X-ray. Now, what's the main mechanism of action, guys? The main mechanism of action is inhibiting ovulation. They are high dose progesterones, right? So, progesterone injections, that is DMPA, and progesterone implants, that is Implanon, they are going to work via inhibiting the ovulation. And this progesterone implants, what exactly they are doing? If you put this implant, they are going to little by little, they are going to release this progesterone. See, they release 67 microgram of etonorgestrel per day. So these progesterones will inhibit the LH. Whenever LH is inhibited, there is no LH surge, there is no ovulation. This is the mechanism of action which needs to be kept in mind. See, Implanon is radiolucent. But if they ask you what is that progesterone only implant which is radio opaque, it is Nexaplanon. Guys, very important thing is Nexaplanon is radio opaque. Implanon was replaced with the Nexaplanon so that it can be captured on X-ray, so that the doctors can know that she is having an implant. So Nexaplanon is radio opaque. Okay, completed. See, DMPA, it is having certain problems, right? What are the problems with the DMPA? The problems with the DMPA are weight gain, osteoporosis. But please concentrate here, these implants, they do not have any problem with the bone. They are not causing any osteoporosis or weight gain, and return to the fertility is quicker. I think you are not able to see that, but what I am saying is, see, return to the fertility is quicker. But with OCPs, it takes 3 months for the returning of the fertility. With the DMPA, it takes almost 1 to 1.5 years for the female to become again fertile. But with implants, the fertility return is quicker when compared to other drugs. Okay, now after this, let's talk about the intrauterine contraceptive devices. Guys, this is the last topic for this video. Now please concentrate. Intrauterine contraceptive device, they are of 3 generations: first generation, second generation, third generation. What exactly are the first generation intrauterine contraceptive devices? See, first generation are inert substances. Okay, they are inert substances. They are not medicated. For example, lippies. Look, this is what they are going to ask you. First generation intrauterine contraceptive devices. Example, lippies loop. So here, whatever you are seeing is a lippies loop. So if this lippies loop is kept inside the uterus, means what it is going to do? It is going to create a inflammatory medium. Or I can say this is a foreign body, right? So this foreign body is going to create an inflammatory condition inside the uterus. So this mild aseptic inflammation doesn't allow implantation, doesn't allow the sperm to reach the ovum. So it will kill the sperm, and it also doesn't allow the implantation happening. So this is how first generation intrauterine contraceptive devices work. Usually they won't ask you in the exam. If at all they ask you, the MCQ that will be asking is lippies loop is a first generation contraceptive device which is inert and non-hormonal or non-medicated. Now second generation contraceptive devices are having copper inside them. So copper containing devices are second generation contraceptive devices. Examples are copper T380A. Okay, copper T380A is a second generation contraceptive device. It is releasing copper ions. What these copper ions are doing? These copper ions, again, they are creating the mild inflammatory conditions in the uterus. The main mechanism of action is preventing fertilization, which means, see, in this inflammatory condition, the sperms cannot survive. Okay, so the sperms will be killed inside the uterine cavity itself, so that there is no fertilization. Okay, so that's the main mechanism of action of copper T. Now, third generation intrauterine devices, they are hormone containing intrauterine device, which means in this intrauterine device, there are these hormones. So these hormones are getting released. Now these hormones, what are those hormones? Those are progesterones. Now those progesterones inside the uterus brings out the atrophy of the uterine endometrium. So if there is atrophy of the uterine endometrium, do you think implantation will happen? No, implantation won't happen. That's the main mechanism of action. So 3 generations, 3 examples. Lippies loop, first generation, copper T, second generation, and Mirena or progestasert, they are hormone containing. Which hormone? Levonorgestrel or second generation progesterone. Okay, levonorgestrel is second generation progesterone, which are present in third generation intrauterine contraceptive devices. Okay. Now, let's see again, we have already discussed what are the main mechanism of action, guys. See, if I am talking about copper containing IUDs, the main mechanism of action is preventing the fertilization. The second mechanism of action is prevents the implantation of fertilized ovum, and they also hinders the ascent of the sperm. Okay, so but in the exam what they will be asking you is the main mechanism of action is prevents the fertilization. Okay, copper containing IUD completed. What about the hormone containing IUDs, levonorgestrel containing IUDs, something like Mirena? What's the main mechanism of action of Mirena? The main mechanism of action of Mirena is it causes the atrophy of the endometrium so that there is no implantation. So inhibits the implantation is the main mechanism of action. So main mechanism of action of hormone containing intrauterine devices. But also remember that Mirena, it also going to make the cervical mucus thick, and in certain cases, they are even associated with the inhibition of ovulation. Okay, so there are some important points to be kept in mind. At the end of the day, copper containing IUDs main mechanism of action is prevents the fertilization. Levonorgestrel containing IUDs, the main mechanism of action is preventing the implantation. Okay, so mechanism of actions completed. Now after this, guys, let's talk a few important points about the copper T380A. This copper T380A is also known as a Paragard, and which is freely supplied by the government of India. So what are the important points, guys? What exactly is this T? T means it is in T shaped. What is this copper? Copper refers to copper is present on the intrauterine contraceptive device. So what is this 380? 380 represents the total area of the copper wire. Okay, total surface area of the copper wire on the intrauterine contraceptive device. What is this A represents? This A represents that even this copper present on the arms as well. It's not only present on the stem, it is present on the arms as well. Okay, so it's also known as Paragard. 380 represents total surface area of the copper. A represents the copper presence on the arms as well. Now it is distributed freely by the government of India. What it is doing? It is releasing copper ions 50 microgram per day. Now important is, see, the way this copper T was inserted, it's a very special technique which is known as a withdrawal technique. Okay, so with which technique the copper T was placed inside the uterine cavity? It's a withdrawal technique. Now this copper T is going to be effective for 10 years. Okay, MCQ. Now guys, if I am talking about in a sickle cell anemia patient, what is the contraceptive of choice? In a sickle cell anemia patient, so DMPA is the contraceptive of choice, and in a patient who is having seizures, the contraceptive of choice is again DMPA or Antra. Same like that, if a female is having stable heart disease and she wants to have a contraception, or there is this HIV female who wants to have contraception, or a female with diabetes with vasculopathy, HIV, stable heart disease. Now, what is the contraceptive of choice? The contraceptive of choice in all these conditions is copper T380A, which is also known as a Paragard. Okay, so these are some important points about the second generation intrauterine contraceptive device, that is the copper T. After this, let's talk a few important points about Mirena. Mirena is third generation hormone containing contraceptive device. Now we are talking about Mirena. Guys, Mirena is third generation contraceptive device which have levonorgestrel inside it. Important point, sir, Mirena's lifespan. See, copper T380A, its lifespan is 10 years, but Mirena's lifespan is only 5 years. What it is doing is every day it is releasing 20 microgram of levonorgestrel. So this levonorgestrel is going to bring the atrophic changes in the uterine endometrium so that there is no chance of implantation. Okay. Now important MCQs. What is the mechanism of action? They prevents the implantation. We have already studied that by causing the endometrial atrophy. Now they are associated with the decreased STDs. Yes. Why Mirena is associated with decreased STDs. Why? Because Mirena is a progesterone containing or progesterone releasing intrauterine contraceptive device. Progesterone, what they are doing? Progesterones, either in low doses or high doses, causes the thickening of the cervical mucus. In progesterone-only contraceptives, we have studied. So, this Mirena is releasing progesterone. It makes the cervical mucus thick. So, it decreases the chances of sexually transmitted diseases. Now, failure, guys, this is very important. It is a progesterone releasing intrauterine device. Now, if it fails and there is pregnancy, now I have already said you, progesterones will decrease the smooth muscle contractions. So, if this Mirena fails, if there is a pregnancy by chance, that pregnancy would likely to end up as ectopic pregnancy. Why? Because the fallopian tube's peristaltic action is gone, so that by chance if sperm meets the ovum, what happens? There will be implantation happening within the fallopian tubes itself. Okay, so important point is failure of Mirena or also failure of copper T also. I am saying failure of copper T or failure of Mirena or in general failure of an intrauterine contraceptive device will likely end up as ectopic pregnancy. Okay, now see, one important point is that usually intrauterine contraceptive device, if they ask you intrauterine contraceptive device or any contraceptive usually decreases the chances of ectopic pregnancy. Take this point. Any contraceptive usually decreases the chances of ectopic pregnancy, but failure of a intrauterine contraceptive device, failure of progesterone-only contraceptive, so failure can lead to ectopic pregnancy, but in general, all contraceptives decreases the chances of ectopic pregnancy. Okay, that's a very important point to be noted. Now, can this Mirena be used as emergency contraceptive? No, Mirena should not be used as a emergency contraceptive. Okay, they are not used as emergency contraceptive agents. Now, after this, let's talk a few important points about the intrauterine devices. Now, what is the most common complication of having an intrauterine device? The most common complication is bleeding. Having an intrauterine device causes bleeding. That's the most common complication. Now, what is the most common cause of removal? See, if you just kept an intrauterine device, but the next month the female is going to come to you and says that, doctor, I don't want to have this intrauterine device within me. Why? If you ask me what is the reason, it causes a lot of pain. So, most common complication is going to be bleeding. But if a female comes to you and she asks you, please remove it, the most common cause of removal is pain. Okay. Now, what is the most common infection associated with copper T use? That is important. Why there is an infection? Very, very important point. Intrauterine contraceptive devices, they are associated with, please take this point. Intrauterine contraceptive devices, they are associated with increased risk of pelvic inflammatory disease. Okay, IUDs are associated with increased risk of pelvic inflammatory disease. Why? Especially in the first month after their insertion. Why? Why? Because if you are trying to put an intrauterine contraceptive device, you are putting this intrauterine contraceptive device through the vagina, through the cervix and into the uterine cavity. Now, there are chances that you might take some bacteria which is present in the vagina or in the cervix, you are taking it into the uterine cavity. Now, there is infection in the uterine cavity, that is endometritis. Infection can spread to the fallopian tube, salpingitis. It can fall onto the ovaries and can cause a tubo-ovarian abscess, and there can be peritonitis. So, there is a risk of pelvic inflammatory disease. So, these iatrogenic procedures, okay, because of this iatrogenic procedures like intrauterine contraceptive device placement can lead to pelvic inflammatory disease. So, MCQ is, what is the infection associated with the copper T use? So, what is that organism causing pelvic inflammatory disease in a female who is having the insertion of copper T? Now, in order to answer that, you have to know a few more important points. What is the most common cause of pelvic inflammatory disease in a normal female? Normal female, the most common cause of pelvic inflammatory disease is chlamydia. But In a female with in situ intrauterine contraceptive device, the most common cause of pelvic inflammatory disease is actinomyces. Okay, actinomyces. Now, there is one more exception. Guys, intrauterine devices can be Lippis loop. Okay, intrauterine contraceptive devices can be first generation Lippis loop or second generation copper T. But third generation intrauterine contraceptive device. What is the third generation intrauterine contraceptive device? Something like Mirena, levonorgestrel containing IUCD. Now, levonorgestrel containing IUCDs, will they increase the risk of pelvic inflammatory disease? No, they won't increase the risk of pelvic inflammatory disease. First generation IUCD, second generation IUCD, they are associated with the increased risk of PID. But third generation IUCDs like Mirena, they won't cause pelvic inflammatory disease. Why? Because they have progesterones. These progesterones will thick the cervical mucus, doesn't allow any ascending infection. If there is no ascending infection, there is no pelvic inflammatory disease. So we say levonorgestrel containing IUCD, that is Mirena, is not associated with any PID. Okay, now what are the other complications? See, while you are trying to put the intrauterine contraceptive device, at the time of insertion, there is a risk that perforation can happen. So perforation because of IUCD happens most commonly at the time of insertion. And ectopic pregnancy. Can ectopic pregnancy be there due to failure of IUCD? Yes, absolutely. Either it is because of intrauterine copper T or intrauterine levonorgestrel containing device like Mirena. Failure of any of them can lead to ectopic pregnancy. There is no doubt. Okay. And also very important thing is, see, failure of intrauterine copper T or failure of Mirena, they causes ectopic pregnancy, no doubt. Okay. But previous ectopic pregnancy, can it be a contraindication for insertion of intrauterine contraceptive device? Previous ectopic, is it a contraindication for insertion of IUCD? No. So very important MCQ, previous ectopic pregnancy is not a contraindication for IUCD insertion. So important point completed. Now what about the fertility reversal? Guys, with oral contraceptive pills, it takes almost 3 months for the reversal of fertility. With the DMPA, we have seen it takes almost 1.5 years for the reversal of fertility. But please concentrate. See, with implants, usually the reversal of the fertility is quicker. But here, with intrauterine devices, fertility returns immediately after removal. Now, see, IUCD, is it a teratogenic agent? Oral contraceptive pills are not teratogenic. Progesterone-only pills, they are not teratogenic. In the same way, IUCDs, intrauterine contraceptive devices, also not teratogenic drugs. Okay, they are not teratogenic. So all the important points we have already discussed. Now what if there is a pregnancy with IUD? Please concentrate. Can a female have intrauterine device and can she have a pregnancy? Yes, she can have it, but most of the time it will end as ectopic pregnancy. 30% of the time, whatever the pregnancy is there, it ends as ectopic. Okay, we have to say her, now you got pregnant having an intrauterine device. Most of the time, your pregnancy will end as ectopic. But there are chances that even you can have normal intrauterine pregnancy also. What we have to do? Now we can ask her, like, do you want to continue? If she says yes, then you can continue the pregnancy. If she says no, you can go with the therapeutic abortion. So what I am trying to put into your mind is, it is possible to have a normal baby with intrauterine contraceptive device. Intrauterine contraceptive device does not cause any teratogenicity in the growing baby. Okay. Now, there is intrauterine contraceptive device, pregnancy has happened. Now, you just try to look the threads of the intrauterine contraceptive device. Right? For example, let me show you. If this is copper T, it will be having threads below it. And these threads are hanging inside the vagina. Now, she is pregnant. She is having intrauterine contraceptive device. Now, if you can see those threads, try to gently remove the intrauterine contraceptive devices by by pulling those threads. So intrauterine contraceptive device is removed and continue the pregnancy. If you are not able to see those threads, those thread was sucked in. Now what to do? Guys, if you are not able to see the threads, if threads are not visible, simply continue the pregnancy and explain her that there are certain risks. Okay, having an intrauterine contraceptive device, allowing the pregnancy, yes, she can have a normal baby, but there are certain risks. What are those risks, guys? See, there can be a chance of infection, there can be a chance of preterm labor, premature rupture of membranes, and intrauterine growth restriction. So at the end of the day, she can have a baby, normal baby with intrauterine contraceptive device. If you can remove it, remove it. If you are not able to remove it, don't remove it and continue the pregnancy and explain her the complications. So all the important points about the natural methods of contraception, barrier methods, oral contraceptive pills, progesterone-only pills and intrauterine contraceptive devices has been completed. So in the next part of the video, we'll be mainly discussing about the emergency contraception and permanent methods of contraception. Hope the video is helpful. Thank you.